Hi, my name is Emma Soneson, and I'm a second-year PhD student in the Department of Psychiatry at the University of Cambridge. Today, I'd like to speak a little bit about our new study, which tests whether an online teacher training program can help to improve identification of mental health difficulties in primary school children. I work within a team of 6 people, and we are broadly interested in how we can use population-level approaches in order to reduce the burden of mental health difficulties in children and young people. We know from national survey data that 10 out of every 100 children who are in their primary school years has a clinically diagnosable mental health disorder. Even more have subclinical or non-threshold levels of mental health difficulties that nevertheless cause distress for both the children and their families. But I'd like to zoom in on the 10 children with clinically diagnosable mental health disorders. Of these 10, we know that we're only identifying about 2 of these children as struggling with their mental health, meaning that we're overlooking the vast majority of children with clinically diagnosable mental health disorders. And if we look at those 2 children we are identifying, we know that actually only about half will go on to access specialist mental health services. So it's clear that there are a number of hurdles then in connecting children and young people with mental health difficulties to high quality care and support. But that first hurdle is actually identification, because if we don't know which children are struggling with their mental health, there's no way we'll be able to connect them with care and support. And so our team wanted to come up with a way to improve identification of mental health difficulties. And we thought to do this in the school setting for a number of reasons. First, we know that most children and young people in the UK go to school, so it's essentially a whole population approach for primary school children. Second, we know that schools are the place where children spend most of their time outside of the home, meaning that there's a high number of contact hours. And third, we know that especially at the primary school level, teachers and pupils have close relationships, and this means that teachers might be particularly well placed to notice changes in behavior or demeanor that might signal that a child is struggling with his or her mental health. And so one of the main ways of identifying mental health difficulties in primary schools is through staff training. And we know that increasingly school staff are expected to both identify and respond to mental health difficulties in their pupils. But we know from national surveys as well as qualitative interviews that actually very few school staff members feel confident in this role. And so that means that there's a critical need for programs that can improve mental health skills and competence for school staff. And we know also that staff training programs in terms of identification are viewed as both important and appropriate, meaning that they could be quite an acceptable way of improving identification within the UK. One of the ways that we found to train staff to better identify mental health difficulties is the program At Risk for Elementary School Educators by the company Cognito, which is based in the United States. At Risk for Elementary School Educators is a 1-hour online simulation-based training program that has 3 main aims. The first aim is to upskill teachers and school staff to recognize mental health difficulties in pupils and to know those warning signs. The second is to give teachers and school staff the confidence and skills to talk to pupils and parents about mental health. And the third is to realize whether further care and support might be merited and to help link children and young people with that care and support. And so we know this program has been used with over 800,000 teachers in the US, but it's never been independently tested and it's never really been used in the UK. And so what we aim to do is bring this program into a number of local primary schools and do some initial testing. So I thought now I'd show you some screenshots from the program itself so you can get a feel for what it looks like. So when you start the program, you meet Jackie Torres, who is a school mental health expert. And Jackie is your coach throughout this training. At the start of the hour, she tells you a number of different skills that can help you identify mental health difficulties. For example, she teaches you about the different risks and the different warning signs that a child might be experiencing mental health difficulties. She also gives you strategies for how to talk to pupils or parents about their mental health, including particular skills such as using I statements. For example, I have noticed that your child has XYZ, and asking permission also for parents. Can we have this conversation? After you get this introduction, you role play as a teacher, whom you can see on the left, and in this case, we're talking to a parent on the right. At each point in the conversation, you have drop-down menus, which you can see on the left, that allow you to make a decision about what to say next. Once you choose an option about what you want to say, for example, if you want to start with the positives about the pupil, that she is very smart and creative and writes great stories, for example, you can click that option and the teacher will say it and you'll get a response from the parent. And you go through this. At each point, you decide what to say next based on how what you have just said has gone over with the pupil or parent and what information you'd like to get next. And you have a number of tools to help you through this conversation. So the first is Coach Jackie, who you can see on the top left-hand corner. And she can come up and help you, usually when you've done something wrong versus doing something good. She can help you to try to move past it and to progress and have a meaningful conversation, even if you might have misstepped. On the bottom, you can see that we have a feedback bar. So as that blue bar progresses to the right, it means that your parent or pupil is becoming more comfortable or that you're doing a good job with the conversation. And on the right, you can see your parent with a thought bubble. And these thought bubbles come up every now and then. You can click to expand them and see how the parent or pupil is perceiving the conversation, which can be quite helpful in deciding where to go next. And so with the funding from Emerging Minds, we are bringing this program to 8 primary schools in Huntington, Wisbech, Peterborough, and Norwich. We're going to do some preliminary or pilot testing with all of the teachers and TAs at each of these 8 schools. And that testing is centered around 3 main questions. So the first one is, does it work? And by that, I mean, does it improve identification rates as well as the accuracy of identification? But also, does it help getting children to care and support? Because we don't just want to identify children as having mental health difficulties and then do nothing. We want to make sure that then the school is acting on those identifications in order to link children with support in school or in the community. We also want to know whether teachers and TAs like the program and find it helpful, because there's no use in airdropping a program down to a school if teachers and TAs don't want to use it or don't find it helpful. And the third is whether it's practical for schools. So we know from our past work that there are significant barriers to school-based identification, including time, cost, and resource issues. And so we want to know whether this program is going to be feasible in schools. And all of this information will help us decide whether to bring the program to further refinement and testing to make it more relevant to the UK setting and to see whether it's going to be a really, truly effective program. So thank you to Emerging Minds for the funding for this study, and thank you all for listening. Take care.